Last year on July 4th, 2020, we were here. About 50,000 new COVID-19 cases were reported that day across the country. A 7-day average of more than 48,000 new cases on that day, and it was going up. Look at that incline. That was the start of what would quickly become this country's second peak in the pandemic. Fast forward about 365 days, and we're now approaching the July 4th weekend once again. Yesterday, about 16,500 cases were recorded for a 7-day average of more than 12,800. Far fewer than this time last year. We know cases are down more than 95% from the highest peak in January. Overall, we're doing pretty well in the fight against the virus. But if you look a little closer at where we are on the curve right now, you'll see that the 7-day average of cases, it's hard to see, got to look right in that right corner, is increasing once again. The new daily COVID cases rose 10% since last week. And that uptick might be due in part to the lagging vaccination rates in this country. But we're still on a slight increase for that right now. Our pace of vaccinations has been declining since spring. President Biden set a goal to get 70% of adults at least one shot by July 4th. But just last week, the White House acknowledged we're not on track to meet that goal. And heading into the holiday weekend, he's right. There are now fewer than 66% of adults with at least one shot. Another reason cases are increasing right now, even if just by 10%, might be the Delta variant, the strain of COVID originally seen in India. It's now present in all 50 states. It accounts for a quarter of all new cases. Experts like Dr. Anthony Fauci of the White House COVID-19 response team say the vaccinations we have are still highly effective against the Delta variant. But CDC Director Rochelle Walensky said yesterday that health officials expect transmission to increase in unvaccinated communities unless those vaccination rates can increase right now. So the question is, when it comes to new COVID cases, are we at an inflection point because of the Delta variant? And if we are, what can we do about it? Joining us now is Dr. Ashish Jha, Dean of Brown University School of Public Health. Dr. Jha, good to see you. Thank you for being with us today. Your take on this. Where are we right now? We're clearly far better than we were a year ago. Still, we're in the tens of thousands of cases, or at least over 10,000 new cases each week. And we have this Delta variant.
Yes, first of all, Ali, thanks for having me back. A couple of things. I mean, first of all, we still have a couple of hundred Americans dying every day. It's not great. That's not where we want to be. We want that number to be lower. Where we are as a country is more and more we are becoming a nation of really two Americas. We have a vaccinated America that's doing well, that I think is going to have a very safe July 4th. And we have an unvaccinated America that is at very high risk from the Delta variant. And unfortunately, I'm worried that the unvaccinated America is going to see a lot of infections and hospitalizations in the weeks and months ahead.
But what do you do about it, Dr. Jha, at this point? Is it a messaging problem? Is it an access problem? I mean, I'm here in New York City where they literally have pop-up stands all over the place, you know, touting vaccinations. Do we have a vaccination shortage in this country, or are we just up against people who don't want it?
No, so there are a couple of things. We don't have a vaccine shortage. We have plenty of vaccines. We have more vaccines than we know what to do with. That's why I actually have been arguing that we got to start shipping some of our vaccines abroad to places that don't have enough. So what's slowing things down here is a couple of folds. I mean, one is a massive misinformation campaign that's been directed at communities of color, has been directed at conservatives, and that has dissuaded some people. There are other people who have, who work 3 jobs, who can't just take a day off after they've had their first or second shot. For them, those barriers still exist. So we've got to do an all of the above strategy. Yes, better messaging. Yes, more trusted voices. Also, yes, policies that make it easier for people to get the shot.
Now, there are worries about what we have to do about this Delta variant and whether or not boosters will be needed. An analysis from Public Health England released on June 14th found that 2 doses of the Pfizer-BioNTech vaccine were 96% effective against hospitalization from the Delta virus. The 2 doses of AstraZeneca were 92% effective. J&J says its vaccine is effective against Delta. We got another report. This is Moderna says its vaccine is effective against Delta. So what does that mean?
Yeah, what that means is I feel incredibly fortunate. All of our vaccines are holding up against these variants. I don't know that 6 months ago I would have predicted that. I am incredibly thankful. It means that if you are fully vaccinated, you do not have to worry about getting sick and dying. You may suffer a breakthrough infection if you're around a lot of unvaccinated people, but you're going to do well. This is amazing. This is terrific and should be all that much more motivation for people to get vaccinated.